Dr. Rachel Brown. We're going to be discussing the carnivore diet and how it might be useful for people with different issues around maybe neurodiversity and mental health, things like depression and anxiety. I know myself and a lot of my viewers are very keen to learn more about this sort of thing. Obviously, I can speak from it from my personal experience, but sometimes it's nice to know the science around things and hear, from the perspective of a doctor, someone that's really spent the time, achieved the qualifications, and has a different perspective on it all, because ultimately she's going to be speaking to lots of people like myself, like some of you guys, about all these topics. So thank you firstly for coming on. Could you briefly introduce yourself for anyone that doesn't know who you are?
Yeah, sure. So thanks for having me. Yeah, so my name's Rachel Brown. I'm a consultant psychiatrist based in the UK, based in Edinburgh. So I work within the NHS and I've been working in psychiatry since 2004. So it's been a while now. And yeah, over the years, for various reasons, I've had a major interest in nutrition and holistic health, really, which deviates somewhat from allopathic medicine. And I published a book last year on the topic of metabolic health and mental health. And yeah, just have been doing a lot of research, particularly in the last year, looking at the literature and speaking at various platforms within the carnivore community, but also within the keto community as well. So one of my major interests is in metabolic psychiatry, and trying to advance that field because there's a lot of research going on there now. And I think a lot to come in the next couple of years. So it's exciting.
Yeah, it's interesting stuff. I mean, we know how the ketogenic diet or a carnivore diet can affect lots of different aspects of health, and usually people fall into this way of eating because they want to lose weight or they've got an autoimmune flare up, and what's the quickest way to sort out? It's usually something like what we sort of would advocate for. So what kind of mechanisms have you looked into in regards to the diet itself and how it can affect psychiatry?
Yeah, so I was lucky enough in early 2021 to train with Dr. Georgia Eid, who many people will be familiar with. She's one of the real pioneering voices within the field of metabolic psychiatry. And I'm, a great admirer of her work. And she's been practicing for quite a number of years now in nutritional psychiatry, or what is now probably more widely known as metabolic psychiatry. So a lot of the science I know from training with her, but also looking elsewhere in the literature. So it's difficult because people always want one particular mechanism, and I think it's actually really complex when it comes to mental health. And for sure, something that Georgia would say is that the brain is a part of the rest of the body, and the brain does not exist in isolation. And yeah, I absolutely agree with that. It's just common sense, really. But there's quite a number of different bodily systems involved when it comes to kind of underlying causes of mental disorders. So many years we've been thinking or telling people to focus on neurotransmitters, and it's all to do with neurotransmitter pathways. And I actually think that's only a fraction of what's really going on for people. So where to start? I always like to start in the gut because I've also trained in functional medicine. So I did that 3 years ago now. And I don't think functional medicine has absolutely everything, but I think it's a really nice way of looking at the body holistically, and trying to really get to the root cause and look at root cause healing, which allopathic medicine doesn't necessarily do so well. And often a lot of things come back to the gut. So the gut brain axis, there's a real connection between the gut and the brain. And there's a hardwired connection in terms of the vagus nerve. But we also know that there is bidirectional signaling that goes from the gut to the brain, and vice versa. So there's various different pathways involved in that, including endocrine or hormonal pathways, and also your immune system. So I quite often start talking to people about the effect that food can have on your gut. And one great example is the effect that gluten or gliadin, which is a specific component within gluten, has in terms of it interacts with a protein in your intestinal cell wall called zonulin. And that opens up the tight junctions between your intestinal cells that line your intestinal wall. And what that leads to and can lead to is intestinal permeability, or leaky gut, as some people might know that more commonly as. And when you have leaky gut, it means that of various things, so not just gliadin or gluten, but other food components, different molecules, different toxins from the bacteria in your gut can translocate across the gut cell wall into the bloodstream and then trigger off an immune reaction within the body. And some of these different molecules that cross into the circulation that aren't really supposed to be there can end up traveling to sites distant within the body. When you have immune system activation, you start off a process which affects your brain, and you can end up activating immune cells in your brain. So there are cells called microglia and also astrocytes that become reactive or become activated. And we know from the research literature that both of those particular immune cells being activated is involved in neuroinflammation and also in regulating the blood-brain barrier. And the integrity of your blood-brain barrier is a big aspect to neuroinflammation as well. So that's one particular pathway, but there are other aspects as well. So I don't know how long you want me to talk about, but I can carry on.
You carry on. This is fascinating.
Okay.
You're explaining
Okay.
it point by point in a very understandable way, which I like.
Okay, good. Just stop me if it's too technical or too below what people are wanting to hear. So when you have immune system activation, sometimes we refer to that as inflammation, but there's lots of different components of inflammation in the body. But you have different immune cells, so cytokines being one type of immune mediator that are released within the body. And we know from studies that people with mental disorders such as depression, anxiety, other disorders as well, you can measure inflammatory markers within the body, one of those being cytokines, but other ones as well, like C-reactive protein might be elevated for some people during an acute relapse. And in some of the research literature, it's referred to as peripheral inflammation. And that's not just referring to inflammation, but an aspect of inflammation is also immune system activation. And that all connects with mitochondrial function and promotion of inflammation kind of downstream in the body. So sometimes when you have a certain amount of immune system activation, it can trigger off further immune system activation and then changes at a very complex level at the level of the brain and the blood-brain barrier. So a real interest of mine that I have is how leaky gut can lead to leaky brain, as in if you have a leaky gut, you can end up having a leaky blood-brain barrier. And your blood-brain barrier is meant to be there to protect your brain and give some control in terms of the nutrients that pass to and from the brain, but also keep out certain substances that are potentially toxic and damaging. And when you have breakdown of a blood-brain barrier, then that usually spells trouble. And there's a lot of research out there saying that happens quite commonly in different neurological disorders as well as mental health disorders. Another aspect, just thinking a bit laterally to more the dementias and Alzheimer's in particular, we do know that hyperinsulinemia, so having high levels of insulin on a chronic basis, leads to dysfunction in terms of the metabolism in the brain. So in terms of how your brain processes energy, and in particular glucose. So you can end up over a long period of time, if you are constantly consuming a diet full of carbohydrates and to an extent seed oils as well, you can end up running into problems with insulin resistance, and that happens at the level of the blood-brain barrier. And you always keep a constant proportion of blood glucose in your brain relative to your blood glucose level more generally in the body. So your brain always has 60% of what your blood glucose level would be in terms of glucose in the brain. And if you run into difficulties with hyperinsulinemia and ultimately type 2 diabetes or insulin resistance, it means that your insulin can't work effectively at the level of the blood-brain barrier, and you end up with a brain swimming in glucose, but the cells in your brain are unable to access that energy because the insulin that's meant to be kind of transporting the glucose into the cells for energy just isn't able to function. And that's one of the beauties of a ketogenic diet. So if you manage to switch to a very low carbohydrate lifestyle, I managed to switch from being a glucose burner to a fat burner. you can switch your metabolism to burn and run off ketones, and ketone bodies just being fat breakdown products. And we know that ketones cross the blood-brain barrier, can get into your brain, and can provide a really efficient fuel source for the brain. And also ketones have anti-inflammatory effects as well. So we know that from the research literature. And so, yeah, I just find it also so fascinating because you can effectively have an insulin resistant brain with lots of glucose there that your brain is unable to access for energy. But if you're able to provide ketones to the brain, about 2/3 of your brain can still run on ketones. And the rest of the brain that needs glucose, your body can provide for that via the process of gluconeogenesis, so production of glucose in the liver. So those are the kind of major kind of overarching mechanisms, but they're all really interconnected, interrelated. And yeah, mitochondrial dysfunction is a huge aspect, and oxidative stress as well, I should mention, comes into that. I don't know if you.
I think there's lots of like I knew this would go in this sort of direction because it's never just one thing. So glad you sort of outlined lots of different mechanisms because this brings to my next question.
Mhm.
So obviously you work in practice speaking to people with different cognitive issues of various different kinds. Um, how would you apply a ketogenic or a carnivore diet to these people? So oftentimes I find and speaking to people and it's they have a lot of objections to following it. They can see people like yourself, maybe me, lots of different anecdotes where the individual finds I feel better on lower or zero carbohydrates or less plant foods or whatever it happens to be. So people
Mhm.
often have these objections where it's like, I can't give up chocolate, I can't do this, or what would you say to those people? Like, what advice are you giving to these sort of people that have this kind of mindset?
Yeah, so it is tricky. So I work within a crisis service in the NHS, so I don't have very long-term contact with people that I see within the NHS. And so I do speak to people about diet, and I do like to ask what people tend to be eating. Whereas traditionally, the way I was trained, we would really only ask about appetite, and we would skim the surface. We wouldn't really be more interested in terms of what somebody was actually eating. Maybe some people would be, but not as standard in our training. And I like to leave people with information. So I have some really good resources from Dr. Georgia Eid that I tend to hand out to people. Um, but sometimes when somebody's in an acute crisis, particularly if somebody's acutely suicidal or floridly psychotic or whatever's going on for them, it's not necessarily the right time to make a big lifestyle change. I suppose if I was seeing people in a less acute situation, I'd perhaps just be asking them to try to examine what their goals are and what's really important to them, because I think it's difficult. I see medications helping people. I definitely have, and I prescribe medications in my practice, but I've come to believe that it's really only modifying certain aspects of an illness or suppressing symptoms. And I am a big believer in trying to treat the root cause ultimately for people, but not everybody necessarily wants that. And some people do just want a quick option, and that quick option might be taking medications. Um, yeah, I think it's probably not a conversation just to have briefly on one occasion. I think it's probably something that people, if they were wanting to examine their own kind of goals and motivations, that they might be best doing that over a series of discussions, possibly with a coach or somebody kind of knowledgeable within the kind of keto or carnivore community. Because I
Yeah,
think you really need to find out what your why is, what your reason is, and there can be all sorts of um, different limiting factors in terms of why people might not necessarily want to change their diet. So I saw somebody recently, for example, someone who's had an awful kind of bipolar illness, who's just been very unwell for a long time, pretty unwell for the last year, and they were on at least 6 or 7 different psychiatric medications. So they've had all of the standard strategies that we would use in terms of medication strategies and combining medicines and mood stabilizers and antidepressant and antipsychotic and benzodiazepine and you name it, they've had everything and they're still unwell. And there's all this great information out there. And I spoke to them about it and left them information to look into. And the next time I saw them, they said that Yeah, it kind of made sense, but they didn't really think it was for them in terms of their lifestyle, and they needed to rely on processed food. And I'm not sure it was just that. I think there are other aspects that come to play in terms of family members and other people in the household, and then just is somebody in a place where they're motivated to actually make a change, and that can be a real issue for some people.
Yeah. On that sort of note, do you find there's much benefit to changing the environment you're in? So what I mean by that is obviously we can work on um, in the right situation, having the right diet, having the right approach to it, then accepting it has to be root cause healing. Because I've had depression for my entire adult life. I've fallen in and out of it so many times. All I've found that's really stuck is root cause healing. Like I can take medication, but it won't nip it in the bud the way
Yeah.
getting to the root of it is. So kind
Mhm.
of what I'm asking is, how would you approach someone that's looking for root cause healing? Like how do you start a ketogenic or a carnivore diet from the point that you kind of accepting that you need to get to the bottom of it now. It's you've done the medical route, you've done the medications and whatever. Um, how would you start the diet? How would you do it from a psychiatrically safe perspective?
Okay. So one of the main issues can be if it's bipolar disorder that somebody's dealing with, because there can be a risk of precipitating mania when somebody goes through the ketogenic transition. And I suppose that applies to other disorders as well, as in people may experience a temporary relapse or deterioration in their symptoms when they're keto adapting. And for anyone who doesn't know, the keto adaptation period would be roughly 3 weeks, although we know that we continue to fat adapt for a much longer period of time after that. But it's just referring to that window where your body is changing at a cellular level. So there are changes that are happening in the mitochondria, and they're changing the machinery that they use to switch from processing glucose to switch to processing ketone bodies and fat breakdown products. And so there can be temporary setbacks for people at that time. So I think it's about having the right support in place, definitely. I think people need to work out what sorts of foods it is that they actually would enjoy eating. So there's no point trying to dive into a diet if you think it's going to be full of food that you just are unable to tolerate or eat. And when I say tolerate, I mean just from a psychological perspective is what I'm thinking. So, sensory taste issues, you need to try and go through a list of different recipes and food lists. So I tend to point people towards reliable ketogenic food lists. If somebody was interested in carnivore, I'd be absolutely supportive of them diving straight into carnivore if that's what they wanted to do. Although, admittedly, for some people, it might be better to have a more gradual transition and trying to phase out one meal at a time or one food group at a time. But there's certain websites that I use in terms of recipe banks. I quite like the Diet Doctor website. I don't know if you're familiar with that one. Presumably you will be. And some other food lists, and then just try to troubleshoot with people about, realistically, how many meals a day do they think they're likely to need, and what sorts of foods do they actually enjoy from the list of ketogenic foods, and can they start to narrow down potential strategies, such as shopping lists or food plans or recipes, to really to kind of knuckle down and get on with it that way. I think electrolyte supplementation is really important during those first few weeks, particularly. So I usually speak to people about having a good quality salt in their diet. So pink Himalayan is the one that I usually suggest and recommend to people, although I know Redmond's real salt's really big in America, and that's what you often hear people talking about. And sorry, I'm not sure if that's answering your question exactly, but
No, I think it does. I mean, you're saying there's a different approach that you have to use for different people. It
yeah.
doesn't necessarily mean you have to go all guns blazing. It might be that that wouldn't be sensible for you based on how your psychiatry is, maybe.
Yeah. Yeah, and then people can be on medications as well that are potentially problematic. So, I mean, most of the drugs in psychiatry you can combine with a ketogenic diet, but there are certain ones where the levels might change, and so you might well need to work in conjunction with your healthcare provider to just do things carefully. And I think particularly if people have struggled with suicidal thoughts on a recurring basis, if there's potential for that to worsen, it is really about having the right support around you and just picking your timing right. But I know there'll be lots and lots of people out there who haven't dealt with those specific issues, who might well be absolutely fine just to dive straight into keto. So yeah, it's difficult. There's no one size fits all for everyone.
Yeah. Yeah, I've got one more question for today. This is, it could be deemed as maybe inappropriate, but what it is obviously you work in a practice where you're dealing with NHS guidelines and things like that. I'm not asking you to sort of talk badly of your colleagues or anything,
Mm.
but how do you objectively deal with people that perhaps say, you've got to have a mixed diet, five a day, and lots of sugar and not much saturated fat? Like, how would you approach them, or does it not really come into the topic of conversation?
Um, yeah, it hasn't come up too much, I have to say, in terms of when I've been seeing patients. But then I think part of the reason for that is that I think it's a certain type of person who chooses to look into the information further, and it does tend to be people who are a bit more open-minded or sometimes from a scientific background, but not necessarily, but people who just genuinely want to get to the bottom of their problems and are willing to take the time to explore different potential health concerns relating to diet themselves. So I've had a lot of people, or a few people recently anyway, come back and say they just hadn't realized how much bad guidance there'd been out there or how they'd been misled in terms of dietary guidelines over the years. And, essentially some people coming back and saying their minds have just been blown by the information that they've been given. I've no doubt I'll probably have colleagues who would recoil in horror at the thought of a ketogenic diet without knowing necessarily anything more about it. So I'll probably meet more resistance, I suspect, from that, as opposed to just people themselves, ordinary people who I might be speaking to about all of this.
Yeah.
But I mean, there's so many different rabbit holes to go down there, and yeah, it gets tricky, kind of politically and in terms of guidelines and those sorts of things.
Yeah, I've experienced that myself. And one reason why I like the interview you had with Bart so much is you come from quite a similar background to me, although obviously your profession is different to mine. I'm a nutritionist. You've kind of dealt with an opposition. So when I did my dissertation at university, I wasn't able to pick the topic points that I wanted to because it didn't go along with the NHS government, you know, nutrition guidelines.
Mm-hmm.
And that was something that stuck out to me as like, I'm trying to propose something here which is going to be useful to people, whether or not the scientific validity of it was that good or not. It's something I was interested in. I think that it would have some application.
Mm-hmm.
So that's partly one of the reasons I wanted to talk to you today. And I think I will hopefully speak to a lot more people like yourself, I mean, your expertise is completely different from mine. That's why I value conversations like this, where you can bring up things that are in your field, your area. So it's not just me, some
Mm-hmm.
autistic carnivore bodybuilder guy saying something. It's someone else, someone, lady from Scotland who's, um, you know, received her PhD qualification in psychiatry sort of thing. It's a completely different
Yeah.
way of thinking.
Mm-hmm.
Do you have any closing thoughts you wanted to mention before we wrap this up?
Um, yeah, I don't know. You said before you weren't sure if you might want to talk a little bit about kind of neurodevelopmental disorders, and I suppose I just wanted to mention briefly that I continue to look through the research literature, so I'm still learning all the time. But there's a lot of really good information out there, particularly looking at the gut-brain axis in autism or autistic spectrum disorders, and in particular looking at blood-brain barrier permeability and expression of certain genes that appear to be different for some people. Um, and I'm just trying to think, how do I break this down so it's not too complicated? But essentially, there are studies showing, like post-mortem studies in humans, that when they've looked at brains from deceased people with autism, that there's been different expression of proteins in the brain that are involved in regulation of the tight junctions within the blood-brain barrier and also within the gut. So although the lining of the gut and the lining of the blood-brain barrier are not identical, they share a lot of similarities. And a lot of the research points just towards higher levels of inflammation. And I've had a few people contact me directly on social media who tell me that they've had a diagnosis of autism, and actually they've found it's particularly carnivore. People have contacted me saying they've had a lot of benefits in relation to their supposed symptoms of autism or that condition, and they've seen a lot of improvement in those symptoms. So I suppose I'm really hopeful and positive about the future in terms of the potential for carnivore specifically to be of benefit. Even if people have found that a ketogenic diet specifically hasn't brought about all the improvements that they wanted to see, and I'm just excited really and want to send out a message of hope that I think there's a lot of good work being done out there, particularly from Revero and everything that Sean Baker is taking forward. And it's great to hear real life stories. And I know I think sometimes people dumb down the importance of anecdotal evidence because once you get hundreds or thousands of people saying the same thing, it's not really anecdotal anymore. And I have a lot of hope for the future. So there are going to be some big trials, hopefully this year and next year, looking specifically at ketogenic diet in different mental disorders, primarily bipolar disorder, but possibly some others like depression or schizoaffective disorder. And it seems to be that a third of people do very well with that dietary intervention, and then another third, it might modify some of their symptoms, and then there'll be other people who don't necessarily see very obvious benefit. And for those people, I just wonder, I'm just very curious about whether going one step further and going carnivore might actually bring about benefit for some of the people who fail on keto. And that's just my hypothesis. I don't know that for certain, but I've certainly been in contact with a fair number of people with major mental disorders who found more benefit going a carnivore way of eating as opposed to just keto. So
Yeah, I mean, anyone that knows me, watches my channel, knows I like a good hypothesis because ultimately they sort of give you ideas of what sort of pilot studies to form. So, like we're having now this conversation, I've had probably 30, 40, maybe more interviews just like this one. Seeing people that have benefited from the carnivore diet. You can draw some links here. There's something here. So that would encourage the primary researchers to look at this and think, okay, we need to study this. Enough people come out and say, this is how it's changed my life. It's going to ultimately lead the way to new research, which is what I'm proposing for, and people like Sean Baker and lots of other people. So
yeah,
I appreciate you coming on today. How can people get hold of you I always say this, if you want to be found?
Sure. Yeah, so I'm on Instagram. I'm probably most active on Instagram as Carnivore Shrink. My website is foodforthoughtpsychiatrist.com. And then I am going to be coaching with a really good colleague, Ali Houston. I don't know if you're familiar with him, but we're going to be starting up some group coaching later this year via metsci.com. So that's our website there. So I'm really excited that we might be able to bring some of the theory and also support people in their journeys to think about changing their diet specifically to optimize their mental health. So that's where you'll find me.
That's excellent stuff. What I'll do to make it easy for everyone is I'll put those links below. Click on them, see what she's got to offer. And yeah, just so everyone knows, people like Dr. Rachel Brown here have not been paid by me to come onto my channel. They've offered up their time. It's sunny here in South of England to speak to me about this sort of thing and help promote a diet that can ultimately really positively impact health outcomes. So thank you very much.
Yeah, thank you for having me.